I'm really excited to talk about a new project that we've developed for our ambulatory clinics in 2025. That project is to control diabetes. Several years ago, we worked on controlling high blood pressure, and we were able to successfully do that working with our physicians and clinicians throughout the state of Nebraska. We hope to use those same techniques to improve the blood glucose project of controlling diabetes. This project will involve all of our entities, including Bryan Medical Center, the Bryan Physician Network, our Bryan Heart team, Crete, Merrick, Grand Island, and our Platte Valley Medical Group. All will be participants in this trial, working to improve blood, glucose, and diabetic control for every patient that they see. Diabetes is a really important diagnosis. It affects lots of people, not only in Nebraska, but across the nation. Around 38 million people throughout our country have a diagnosis of diabetes. That's about 1 in 10 people. It's the 8th leading cause of death, and we know diabetes contributes to significant risk for visual loss, kidney injury, nerve problems, as well as heart disease, stroke risk, and limb loss. Last year at Bryan Health, we saw approximately 17,000 adult patients with diabetes throughout our health system.
The barriers that our patients face fall into broad categories. I'd say the first one would be financial, whether it's insurance payment, private pay, what their insurers will cover, whether or not it's paying for their medications, paying for their insulin. Another category I would put barriers in is social, whether or not it's lacking family support or the ability to travel to have their blood drawn or to meet with providers, or even things like not being tech savvy. And then the last category that I would say was a barrier is medical or disease related. People have trouble with vision. They can't see how much insulin to draw up, what medications maybe they're taking, manual dexterity to run the machines related to their diabetes. They just get tired of trying to manage and deal with the complicated disease and trying to understand everything they need to do.
Managing diabetes is not a one-man army. One person cannot do it all by themselves. So we work collaboratively through a collaborative practice agreement, which allows us to start, stop, adjust medications, assess the current medication list. We take into account other chronic disease states that these patients may have. So patients that are more hands-on, we can follow up and check in with them every couple of weeks. For those who are more well-managed, we'll see them every few months. Across the system, we have coverage within the specialty clinics, so that would be Bryan Heart, cardiometabolic, as well as endocrinology, where I'm at. And then we also have primary care coverage across 7 different clinics. Each person may have different requirements or needs, so these extra resources are available to better patients' health.
Being in the role of a family physician and seeing people who are diabetic is interesting because usually when I see them, they don't know that they're diabetic. I'm usually the first person who tells them, you have pre-diabetes, you have diabetes. And the first thing that we usually do in terms of simplistic accuracy is I will take that patient and we will talk about it in a very simple initial appointment. We actually will check our blood sugars together. So that way they don't feel like I have to learn all about diabetes in this 30-minute appointment. Utilizing the team-based approach has been really gaining popularity in the last few years, and I've been really appreciative of it because it really truly makes sure that patients are getting the care that they need. The fact that we can have a clinical pharmacist who can follow up with patients and making sure that we're getting improvement on their diabetes, that we can have a social worker who can make sure that they're able to afford their medications. These are all huge components in trying to prevent diabetes from getting worse for people and making sure that we can have a positive outcome for them.
Diabetes is already a pretty big problem. Right now, with the tools that we currently have, we're only getting about half of our patients to goal. Knowing that the numbers of patients with diabetes is only going to increase, we've got to be able to get our arms around this better. Diabetes has changed a lot. Now, with the technology we have, it's a completely different set of tools that we have to help patients. Continuous glucose monitors have been a huge improvement. Now we have sensors where patients can wear this device and be able to know what their blood sugar is in real time, which direction it's trending. The other medications that have come on the scene, GLP-1 receptor agonists as well as SGLT2 inhibitors, are classes of medications that have shown to reduce your risk of cardiovascular death. So that's definitely been a game changer. I think it's exciting to see what we're doing here in Lincoln, but we all have the same medical record. Epic with its Treat, its Grand Island, its Kearney. There's a lot of things that we all do kind of in our silos. This is a good platform for us all to share what we're doing, and we can learn from each other and share what we've done to make life easier for all of us.
Healthcare is a team sport, or a team approach. We know that every individual on the healthcare team is really important. We hope to really improve our diabetic control and therefore, over time, improve the outcome for our patients to live long, healthy lives and live the lives that they want to live as far as a healthy Nebraskan.